Okay, so to truly understand pathology or this injury, I think we need to get a grasp of the basics of the anatomy and the biomechanics. The anatomy, we've got your femur, your tibia, that's the top and the bottom bone. Those two bones come together to make up the knee joint. Also a part of the knee is your kneecap. So your kneecap is a sesamoid bone, meaning it's just floating within the tendons of your quads. The whole purpose of it is just to increase the force production or the leverage of your quadricep muscles. That's it. That's the whole reason that we have. That can also come some problems sometimes, hence this anterior knee pain or patellofemoral pain syndrome or patellar chondromalacia. You get the point. There's a lot of different names for the same thing. All of it has to do with irritation on the back side of that kneecap. Why do we get irritation on there? Well, if we get too much loading or too much too soon, whether it be repetitive movements, sustained postures with compression on the back of that kneecap, it's like a bruise. It's like a bruise on the back of your kneecap. Similar that shin splints were to the bones of your lower leg, this is like that to the cartilage or the soft tissue on the back of your kneecap. So over the most common causes of this anterior knee pain or runner's knee and the most common fixes. One is going to have to do with range of motion. There is a range of motion deficit where you are tight in either your quadricep muscle or your ankle, which is causing more wearing on back of that kneecap, on certain parts of that kneecap, and not spread along a certain part of it. It's just isolated to one part of the back of the kneecap, so therefore it's more susceptible to wearing down or getting irritated. The other is going to be a strength issue. A lot of times we've talked a lot, if you've been following me for a bit, your hip abductors or your glute med is the big brother, the big sister of your knee. Your knee is at the expense of that hip. If you have some weakness or not activation of your hip abductors and you get that pelvic drop, well, what happens with that is that force, every time you land, it's still coming towards your center of mass. It's causing different torques on our body. If you get that pelvic drop, it's going to cause a lot of stress on that knee or on the back side of that kneecap. So we're going to talk about a stability or a strength issue that can be the culprit. It will be technique driven. There's something about your running form. We're going to go over one common fault, overstriding. We're going to go over some simple ways of how to clean that up or how to fix that. And then also we'll talk about when should you get help. Maybe if you can't get this on your own or heal this on your own, you see a PT or another provider that's able to offer you a little bit more guidance or a little bit more assistance just to get your body back on track.